Hi, this is Dr. Jeff Kieliszewski. Welcome to my weekly video blog. This week I want to spend some time discussing a topic that gets occasional media attention, but I would argue the media coverage does not really do the topic justice. So today I want to talk about PTSD and veteran service-connected disability from a forensic psychologist perspective. So some of you may be wondering, why would a forensic psychologist be interested in or talk about service-connected disability with veterans? After all, we define forensic psychology as application of psychological science to the legal system. Well, actually formal disability is a legal issue. So it's definitely within a forensic psychologist's purview in the type of work that we do. In fact, service-connected disability can actually be considered a legal status with various governmental agencies. So for the past 2 or 3 years, I've been doing some work for the VA, conducting forensic psychological evaluations to be used in determination of service-connected disability. So I want to share with you some of the research behind this topic, my observations, and an opinion or two. So when I do psychological evaluations that will be used in determining service-connected disability, these evaluations task me with a few different questions I need to answer. The first question is, does the veteran suffer from a diagnosable mental health condition that began or occurred as a result of their involvement in the armed services? Other questions. What is the nature and extent of the impairment, and how does this condition affect the veteran's ability to work or be successful in the work environment? Now, these types of evaluations can obviously become very complex, and these are very difficult questions to answer, as you can imagine. The VA is the one that makes the decision on whether or not someone has a service-connected disability, not the examiner. I just have to answer those questions that I defined earlier. Now, usually what happens is the VA makes a determination of service-connected disability by making a disability rating. Now, this rating of the benefit is basically a percentage determination. So someone could be determined to be 100% disabled due to a service-connected condition, or they may actually say only 30% disabled. Again, as the examiner, I don't make that decision. That's what the VA uses my report in order to make the decision. Now, I'm seeing veterans who have a variety of different mental health conditions, but as you can imagine, the condition that I most often see is post-traumatic stress disorder, or PTSD. So for purposes of our discussion, let's define PTSD. So PTSD is an anxiety disorder, and PTSD is a condition of mental or emotional stress that occurs as a result of an injury or severe psychological shock. Typically, to meet the criteria for PTSD, you have had to experience a traumatic situation where you feared for your safety, you feared for your life, or you were exposed to incidents where others lost their life or encountered injury. Now, some typical symptoms of PTSD can often include sleep disturbance, nightmares, feelings of emotional detachment from others, hypervigilance in your environment or recurrent fear, difficulty trusting others, emotional lability or unstable emotions, and that's just to name a few. Now, some people with PTSD also experience flashbacks, or a feeling state where they have intense feelings that were similar to the emotions they experienced when the traumatic event occurred in the past. And in the most severe forms of PTSD, an individual may actually dissociate or actually feel that the traumatic experience is occurring again. Now, people can develop PTSD from a myriad of traumatic experiences, including being abused as a child or an adult, being in a traumatic accident, witnessing atrocities, being the victim of assault or combat. And I've seen people who develop PTSD from all those types of things. Now, from a clinical perspective, PTSD can often present in a variety of ways as compared to other mental health conditions. So for example, major depressive disorder seems to present in a manner that's similar with most people. The intensity of symptoms can vary, but it's a straightforward diagnosis. Now in PTSD, you can see varying collections of symptoms with varying intensities. So for example, I might see someone who primarily has symptoms of PTSD, that they have feelings of estrangement from others and sleep disturbance, nightmares, hypervigilance, but they don't have any flashbacks. And then I might see someone who has PTSD that has florid and intense flashbacks in response to triggers, a smell or a sound that reminds them of their traumatic experience, but they still feel connected to people, and then they don't have any significant issues with emotional instability. Now, another complicated factor that occurs in veteran PTSD is sort of these secondary conditions that can develop or grow out of the PTSD. Depression and suicidality is one of the major ones in this population, but also substance abuse is another that you'll see frequently. Another interesting thing, and I call this interesting for lack of a better term, because for people that are actually experiencing service-connected PTSD, it's more than just interesting. It affects many aspects of their life. So forgive me for using the word interesting. I'm sort of doing it from kind of the cold clinical perspective. And I don't really know a better word to describe this. But from that cold clinical perspective, one of the things that's interesting that I see with PTSD is how PTSD symptom manifestation can change in this population. So I might see someone who was in combat and had a traumatic experience. But when they leave the military, they start to abuse alcohol, for example, sort of self-medicating. Then they develop depression. And then they're showing very few overt signs of PTSD. And then say 10 years later, they stop drinking and they get treatment for the depression. And then all of a sudden the depression lifts, and now there's symptoms of PTSD that emerge. So a lot of times when I get these evaluations, the VA may say, well, we just had this person down for depression and alcohol abuse, and now all of a sudden they have PTSD. So, for example, I've had a few cases where a veteran is rated service-connected disability for depression, and they stop drinking, their depression gets better, and then their PTSD comes out. So their diagnosis changed. Now, another interesting observation is I see combat veterans mostly from Afghanistan War, Iraq War, and Vietnam. I see a few Gulf War Desert Storm, which occurred in the early 90s, but that's a smaller population because the conflict wasn't as long. Now, these veterans from different wars often present with similar traumatic experiences in combat that resulted in PTSD, and also some very different experiences that resulted in PTSD. And that's oftentimes based on the particular war or conflict they're involved in, the times or the culture when the war occurred, or actually the culture and the times when they came home after their combat. This can often affect how their PTSD symptoms manifest and how the veteran copes with these symptoms. For example, I'll see Vietnam veterans who talk to me about how they were treated when they came back to the United States after serving in combat, and how this affected the way that they emotionally coped with their trauma, made sense or were unable to make sense of their experiences. In the more recent wars, there's been so many advances in combat medicine that what I'm seeing is a lot of veterans coming out of those conflicts, Iraq and Afghanistan, with or surviving combat injuries at a higher rate than in the previous wars. So what you're seeing in those veterans a lot of times is they're dealing with chronic medical issues, a lot of pain, traumatic brain injury issues, in addition to the PTSD. Because in the past, those combat injuries would likely have resulted in their death. So this obviously complicates the clinical picture in evaluating and determining if a PTSD is present, but also how to design treatments in order to address the PTSD in this population, because there are other issues going on, primarily medical issues. Now, another interesting observation in doing this work, I'm also seeing veterans with PTSD from non-combat related experiences. Most oftenly, this is involved with the VA calls MST, which is military sexual trauma. This is a PTSD that results from someone being sexually assaulted while they're in the service, often by other service members. Now, obviously, I'm seeing this more frequently in female veterans, but I'm also seeing this in some male veterans. Now, as you can imagine, this manifestation and how to treat this type of PTSD can look different and in some ways similar to combat-related PTSD. So one thing that strikes me about doing this work, I was never in combat, I never served. And I could tell you by talking to these veterans, I think that most people cannot even come close to understanding how combat can affect a person unless you actually experienced it yourself. Another thing, there's this phrase, thank you for your service, and sometimes I get concerned this is becoming more of a cliche than people actually really meaning it. But it's important and it's good that people are talking about supporting our veterans and supporting our military. I would argue, and this is an opinion, that if you really want to support our military and our veterans, then become interested in ways and policymakers that are invested in not sending our military into combat. Because I can tell you, the human cost veterans often pay for being in combat is immense and beyond what most of us can understand. And I don't think the media stories can really fully communicate what some combat veterans with PTSD go through on a daily basis. So, in summary, PTSD and service-connected disability is obviously a very complicated issue. It's an issue that can't be taken lightly. It's a significant issue. It is out there. It's a changing issue. And again, I want to emphasize my own opinion that I think it's one of these issues that unless you actually experience it yourself, you have no idea what some of these folks deal with on a daily basis. All right. So if you know someone who may be interested in this topic, please pass along this link. If topics on this channel interest you, please subscribe to the channel. You can also follow me on Facebook, Twitter, and Instagram. There are links to those pages on the YouTube channel. Also, there's a link to my email. Email me if you have any questions. Please comment on this video if you've dealt with these types of issues in your personal life or professionally. You can also email me if you have any topics or questions that you would like me to address in a video blog. Thanks for tuning in.